Have you ever wondered if your cat is feeling terrible, but you might not even know it? Cats are masters at hiding their pain, showing only the subtlest signs that something is wrong. A slight change in your cat's behavior, a small shift in their routine, these could be desperate cries for help. Missing these signals could mean putting your cat's life at risk. In this video, we'll expose the most critical, life-saving signs that your cat needs immediate attention. Every cat guardian needs to know these signs because your cat's health depends on it. Before we dive in, please subscribe to Wise Animals and hit the notification bell to make sure you don't miss any of our future videos. Number 1. Dragging hind legs. If your cat, who usually walks normally, suddenly begins dragging their back legs, it could indicate a serious health issue. One possible cause is a blood clot that forms in the cat's body and travels down to the back legs, where it becomes lodged and blocks blood flow. This can lead to a loss of control over the hind legs and severe pain, often causing the cat to cry out or vocalize excessively. Other signs to look out for include heavy or labored breathing and an inability to move the rear limbs properly. This may make it appear as though the cat has a broken back. Additionally, the paw pads might look pale and feel cold to the touch due to the lack of blood flow. While this type of clot most commonly affects both back legs, it can also occur in just one leg, the front legs, or other areas of the body. Cats with heart disease are at higher risk for this condition. It's crucial for cat guardians to recognize these symptoms to provide urgent care. Number 2. Stinky breath. If your cat has unusually stinky breath, it could be a warning sign of gum disease or tooth decay. A cat's mouth harbors hundreds of bacteria, and when dental hygiene is neglected, these bacteria can lead to serious oral health issues. To minimize the risk, make sure to brush your cat's teeth regularly and schedule an annual dental cleaning with your vet. Proper dental care can help prevent bad breath and maintain your cat's overall health. Number 3. Open mouth breathing. Normally, a cat's breathing should be so quiet and subtle that you need to look closely or listen carefully to notice it. If your cat's breathing becomes noisy, rapid, or causes noticeable movement in their belly, it may indicate an underlying problem. Cats almost always breathe through their nose, so if you see your cat breathing through their mouth when they aren't hot, stressed, or tired from physical activity, it's a strong warning sign. Open mouth breathing in cats is unusual and can point to serious health issues. Number 4. Trying to use the bathroom, but nothing comes out. Numps out. If your cat is straining to use the litter box, but nothing comes out, it could indicate a urinary tract blockage. This condition may cause a cat to sit in the litter box and push or strain without being able to urinate. It's a clear warning sign of a serious blockage that, if left untreated, could become life-threatening. Urinary tract blockages are especially common in neutered male cats, making it essential for cat owners to recognize the symptoms. Number 5. Change in pupil size. A cat's pupils change size and shape based on light levels and emotions. By dilating their pupils, cats allow more light into their eyes, helping them see better in the dark. During daylight, cats' pupils will contract according to the brightness around them. Interestingly, pupil size can also reflect a cat's mood. If your cat's pupils are dilated even in normal lighting, it could mean they are stimulated or not relaxed. This could indicate excitement, anxiety, stress, or even fear in your cat. Cats often have dilated pupils during their heat cycle or in moments of enjoyment, such as after eating their favorite food. However, persistent dilation without an obvious reason, like ambient light or stimulation, may point to a health issue and should be evaluated by a vet. Another important detail is that a cat's pupils should be symmetrical. If you notice unequal pupil sizes, it is not normal. Number 6. Drinking excessive amounts of water. If your cat starts drinking more water than usual, it could be an indicator that something is wrong. Cats typically don't consume large amounts of water, so if you notice their water bowl emptying faster than normal, it's worth paying attention. Excessive drinking in cats can signal endocrine issues such as diabetes or hyperthyroidism. It could also point to potential kidney disease, which is more common in older cats but can sometimes develop earlier. If you observe your cat drinking excessively, it's important to consult a vet to identify the cause and ensure timely treatment. Number 7. Too many hairballs. When cats groom themselves, their tongues, equipped with tiny hook-like structures, catch loose and dead hair, which is then swallowed. Most of this hair passes through the cat's digestive system without issues, but sometimes it stays in the stomach and forms a hairball. Cats will often vomit hairballs to remove them. While the occasional hairball isn't a cause for concern, frequent hairball vomiting can signal a problem with your cat's digestive system and should be checked by a vet. To help prevent hairball formation, regular brushing, ideally once a day, can reduce the amount of hair your cat ingests. Adding more fiber to your cat's diet can also aid in the healthy movement of hair through their digestive tract. Number 8. Discolored gums. Your cat's gums can reveal a lot about their overall health. Healthy gums should be a bubblegum pink color. When you press a finger against the gum, it should turn pale pink or white, and then return to its normal pink shade within 2 seconds after releasing the pressure. Pale gums often point to blood loss or poor circulation, as the pink color comes from blood flow beneath the surface. Bluish gums can indicate a severe lack of oxygen and require immediate attention. Bright red gums may signal toxicity or overheating, or if the redness is localized above the teeth, it could suggest a dental issue. Yellow gums often point to potential organ problems, such as liver disease. Number 9. Not eating. A loss of appetite is one of the main signs that something may be wrong with your cat. While cats can be known for being picky eaters, you likely know what's typical for your pet. If your cat, who normally eats a certain amount daily, suddenly becomes uninterested in food, it could indicate an underlying health issue. Conversely, a sudden increase in appetite can also be a warning sign. If a cat that usually has a moderate appetite starts begging for more food than usual, it could be due to issues like diabetes, hyperthyroidism, or problems with nutrient absorption. Any significant change in your cat's eating habits, whether a loss or spike in appetite, should not be ignored. Number 10. Throwing up a lot. Some people think it's normal for a cat to vomit once a week, but this isn't true. While occasional vomiting or a few hairballs a year can be normal, frequent vomiting is a sign that your cat might be unwell. Common causes of vomiting in cats include ingesting something toxic, hairballs, or sudden changes in diet. However, persistent vomiting could also indicate more serious issues, such as cancer or organ problems. Number 11. Coughing. Identifying a cat's cough can be tricky, as it often looks like the cat is trying to vomit but isn't able to. This behavior is indeed coughing, which can be triggered by various factors. Minor causes include allergies, hairballs, or even asthma. However, persistent or recurring coughing could point to more serious issues, such as heart disease. While an occasional cough might be normal for some cats, it's important to pay attention if the coughing becomes frequent or prolonged. Number 12. Unexpected weight gain or weight loss. If your cat experiences sudden weight gain or loss without an apparent reason, a visit to the vet is essential. A cat's physiology differs significantly from a human's, so even small weight changes can be impactful. For instance, a cat gaining or losing just 1 pound is similar to a human gaining or losing about 10 pounds. While gradual weight loss may be common in older cats as they lose muscle mass, sudden or extreme changes can indicate serious health issues, such as cancer or other underlying conditions. Monitoring your cat's weight and acting on any noticeable variations can help catch potential problems early. Number 13. Limping. Limping in cats might seem straightforward, but it's often underestimated. If you come home and see your cat suddenly limping, it's crucial to call the vet immediately. While cats are known for their impressive jumping skills, they can still fall and injure themselves, resulting in a broken or sprained limb. Quick treatment can ensure proper healing and prevent long-term issues. It's also important to remember that although cats are adept at landing on their feet, they don't always manage to do so, especially from high or awkward places. Never hold a cat upside down and drop them to see if they can flip over. It's dangerous and can lead to injuries. Additionally, make sure your cat doesn't have access to open windows to prevent accidental falls. Number 14. Increased hiding. Cats naturally enjoy hiding, but if your cat starts hiding more frequently than usual, it could be a sign that something is wrong. Cats often retreat to secluded spots when they are in pain, feeling unwell, or experiencing stress. A sudden increase in hiding behavior can indicate that your cat is dealing with an internal issue or illness that may not be immediately visible. Number 15. Changes in maintenance habits. Cats are known for their meticulous grooming and pride in keeping their coats clean and shiny. If your cat starts to neglect their grooming routine, it may be time for a vet visit. This change could indicate that your cat is dealing with an underlying health issue causing fatigue, which would explain their unkempt appearance or the sudden change in grooming habits. A cat that isn't maintaining their usual grooming standard might have matted or dirty fur, debris stuck in their coat, dirty ears, or even feces clinging to their rear end. Such signs suggest that something is interfering with your cat's ability or desire to keep up their grooming. Number 16. Behavioral changes. Has your usually social and friendly cat become aggressive or withdrawn? Or has your typically happy and energetic cat turned into a tired and irritable grouch? Maybe your chatty cat has suddenly gone quiet. Sudden shifts in a cat's behavior are always a reason for concern. No matter which direction the behavior changes, whether they become more aggressive, shy, lethargic, or silent. If your cat starts acting out of the ordinary, it's important to contact your vet to discuss possible underlying causes. If you found this video helpful, please give it a thumbs up. Your support not only encourages us, but also helps other cat lovers discover our content. Don't forget to share your experiences in the comments below. And consider subscribing to the Wise Animals channel for more informative videos on understanding and caring for our feline friends. Thank you for watching, and we'll see you in our next